Are you having a heart attack or is it just anxiety?
It is the single most terrifying question you can ask yourself. You're lying there, chest tight, your heart is hammering against your ribs, and your brain is screaming, this is it, this is the big one.
And we need to validate this right now. If your chest hurts or you feel like you can't breathe, that pain is real. It is not all in your head.
Exactly. It is a very real chemical flood. Your brain's threat center, the amygdala, is incredibly fast, but not very smart. It literally cannot tell the difference between a tiger chasing you and a scary, intrusive thought.
So it just hits the panic button.
Right. It dumps adrenaline into your bloodstream instantly. Your heart rate spikes to pump blood to your muscles. Your digestion shuts down. You are primed to fight for your life.
But you're just sitting on the couch.
Yeah, you're totally static. So all that survival energy has nowhere to go. It turns into shaking, a racing heart, and muscle tension. A heart rate of 140 beats per minute while watching TV feels like a medical emergency.
It mimics a heart attack so perfectly. But if we look at the clinical data, there are clear differences. We need to get straight to the tests. How do we tell them apart right now?
Let's look at the pain first. Because anxiety pain is usually sharp. It's stabbing, it's acute, and it's right on the surface. You can usually point to it with one finger.
Whereas a heart attack.
Visceral. Crushing, squeezing pressure deep behind the breastbone. It feels like an elephant sitting on your chest, not a needle poking you.
And the breathing. Because the air hunger makes people rush to the ER thinking their throat is closing.
But your airways are actually wide open. It's just muscle tension in your neck from the fight or flight response. You're actually breathing too fast. You blow off too much carbon dioxide.
Which changes your blood chemistry, right?
Exactly. And that chemistry change is what makes your fingers tingle and your head feel dizzy. It's not a stroke. It's hyperventilation.
Okay, that changes everything. Understanding the biology takes the fear down a notch. But we promised actionable tests. 3 diagnostic checks you can run on yourself right this second.
Yes. Test number 1 is the reaction to relaxation. Basically, anxiety symptoms respond to calming techniques. Physical pathology generally does not.
So if I sit down, close my eyes, and take slow, deep breaths.
And your chest pain starts to ease up or the dizziness fades, that points strongly toward anxiety.
Because if it was a blocked artery...
The blockage does not care if you are meditating. A heart attack won't resolve just because you slowed your breathing. Same with the gut issues. If a peaceful walk settles your nausea, it was stress.
That is a massive filter.
Yeah.
Okay, test number 2. The symptom shapeshifter.
I love this one. Anxiety is chaotic. It's entirely inconsistent.
It jumps around, heart palpitations on Tuesday, nausea on Wednesday, blinding headache on Thursday.
Right. But real medical emergencies follow a logical, predictable pattern. You don't have a heart condition that suddenly turns into a stomach flu and then becomes a numb foot.
It's the whack-a-mole effect. You stop worrying about your heart, so your stump starts acting up.
Precisely. If your symptoms are jumping from system to system, that's your nervous system misfiring, not a localized disease.
Okay, test number 3. Duration and progression. This is the timeline.
Panic attacks operate in waves. Adrenaline has a half-life. The attack builds, peaks within 10 to 20 minutes, and then it subsides. You literally cannot sustain peak panic forever.
But a medical emergency.
It's relentless.
Yeah.
A heart attack involves sustained pain that just gets worse. It doesn't fade away after 20 minutes.
So if the symptom peaked 10 minutes ago and is now fading, you're riding the downside of an adrenaline wave.
Exactly.
Okay, we've done the tests. Reaction to relaxation, the shapeshifter, and duration. It points to anxiety. But the brain is still screaming danger. We need an immediate intervention to stop the spiral.
You have to hijack your brain, pull it out of the catastrophic what-ifs, and slam it back into present physical reality. The gold standard for this is the 5-4-3-2-1 grounding method.
Let's do it right now. Do not skip this. 5 things you see.
Detail is key here. Don't just look at a wall. Look at the crack in the paint, the dust floating in the light. Really focus on the visual details.
4 things you can touch.
And physically touch them. Grab your shirt fabric. Feel the cold metal of the table. Notice the exact temperature and texture.
3 things you hear.
Listen past your racing heartbeat, a car driving by, the hum of the refrigerator.
2 things you smell.
Sniff your sleeve, or recall a sharp scent like pine or lemon.
And 1 thing you taste.
Even just the inside of your mouth. By the time you do this, your brain has forcefully switched gears 5 distinct times.
It cuts the fuel line to the panic engine.
It forces your prefrontal cortex, the logical brain, to take over from the emotional alarm system. You remind your nervous system that you are safe in this room.
Use this method right now if you are spiraling. It works. But one final critical reminder before we go.
Always consult a doctor if you are unsure. If you have chest pain radiating to your left arm or jaw, or sudden severe shortness of breath at rest, do not wait.
Boom, go to the ER. Err on the side of caution. Let a professional rule out the physical so you can safely treat the mental.